There we go. Good afternoon, everyone. I'd like to start with a few thank yous. I want to thank my mentors, Dr. Judah Ranch of the Aging Department, and Dr. Stephen Cruz, who I don't believe is here, but I'd like to thank him as well. You guys have been a wealth of insight and support, answering even my smallest questions, so thank you. I'd like to thank my advisor, Mr. McAlpine, who's guided me through the process for the past 2 years. And I'd like to thank Dr. Freeland, who's my 480 instructor and the director of our program. And I'd like to thank the rest of the INDS staff who've given me a lot of constructive feedback. So to begin today, I'd like to take us back to the Bronx in the 1960s to an institution where we're going to look at a patient named Miss Rosalie B. Miss B is extremely Parkinsonian. She spends the majority of her time frozen, unable to move, normally either seated or standing in the hallway with her finger fixed to her spectacles. However, she is a huge fan of Chopin, and if you are able to get her to a piano and get her to sit down at the bench, she can play the entire length of the song without pause and without tremor. And many people would look at this and say, this is a miracle, it's miraculous. But a music therapist would say, no, in fact, this is science. The mind as a metronome. So I'm going to be talking to you today about music therapy as a treatment for Parkinson's disease. And specifically, my research question was, can this improve quality of life for these patients? And sort of the main purpose of the project was just to look at an innovative option for an incurable chronic condition. So what is Parkinson's disease? And you're probably thinking of Michael J. Fox, Muhammad Ali, that's that disease they have, right? You'd be right. It's also the second most common neurodegenerative disorder in the United States, right behind Alzheimer's disease. So what happens with Parkinson's disease is actually cell death of dopamine-producing cells in the substantia nigra of the basal ganglia. So it results in a variety of symptoms, from motor symptoms like tremor, rigidity, postural instability, to non-motor symptoms like loss of sense of smell, depression, cognitive issues, especially at the end. And this is the basal ganglia, and we can see it's a subcortical structure, and then there we can see the substantia nigra. So there isn't any cure for Parkinson's disease, and while there are drug treatments, the most effective of which is L-DOPA or levodopa, sort of synthetic dopamine, it isn't a long-lasting solution. Most people do develop drug resistance, and the side effects can be many and severe. So it's definitely necessary to look at some other options. And music therapy has been something that showed some preliminary effectiveness. Music therapy is both broader and more specific than most people think. It's broader in that it's used just in a variety of populations, from Alzheimer's, autism, aphasia, stroke, multi-infarct dementia. It's used from children to elders. It's more than just listening to music. It could be learning to play an instrument for fine motor control, or sort of sing-songing what you're trying to say for speech disorders. And then it's more specific, and then we're really looking at not just music being used therapeutically, but music between a credentialed music therapist and a patient in a person-centered approach, where we're looking at an individual's strengths, weaknesses, needs, and goals. And it's historically based, been very strongly established in the United States since about the 40s. So what's happening when a neuro patient responds to music? One patient who has Parkinson described her main symptom as, I can't start and I can't stop. And this refers to the inability in Parkinson's to initiate movement or control movement. So they may accelerate out of control or freeze in their movement. And this makes sense, since the basal ganglia is sometimes referred to as organs of succession, and they control sequential motor processing, this patterned response, such as walking. So a music therapist might look at this and say, the problem here is that we've damaged this person's internal rhythm. We've damaged their mental metronome. So the simple solution would be to offer an external metronome. However, we know it's not that simple. You can't slap a pair of headphones on any Parkinson's patient with a steady beat going, and that's going to work for them. You really have to find the right stimulus for that person. For Miss Rosalie B, it was Chopin. For someone else, it might be reggae or rock and roll. You name it. And especially with a musical stimulus, this is a stimulus that lasts over time, so you allow for extended release and relief for this person. So what did I see driving interdisciplinarity? In general, whenever we look at health, sort of as a snapshot of someone's health, we're looking at things that are picked apart by these disciplines, but that are integrated really seamlessly within ourselves. And with music therapy being a person-centered approach, we're definitely going to be looking at health comprehensively. And then lastly, Parkinson's is a complex neuro disorder. There are going to be a wide variety of symptoms that differ in patients, and they're going to be explored by different disciplines. So my degree is biopsychosocial approaches to health, so these are the disciplines I looked at. I also looked at music. And then with biology, I mostly focused on the neuroscience, what was going on, physical rehabilitation as well. With psychology, I referred mostly to mental wellness, cognition being an issue. Music therapy is used psychotherapeutically, so that was a subdiscipline I explored. And then with the sociology discipline, it was mostly about that relationship between patient and client, or therapist and client. And then with music, it was primarily the discipline of music therapy itself. So how did I integrate these disciplines? I used some Miller and Boyksman-Sia bridging strategies, and let's start with reasoning through analogies. That goes back to my title, The Mind is Metronome. Actually wasn't just a flowery introduction. And what we're looking at here is music. We're taking a music perspective and looking at what is primarily a biological concept or a psychological concept, the mind. And rather than seeing this interconnecting web of neurons, we're saying, let's look at it like a metronome. And this gives birth to this new solution of being able to use music for therapeutic benefit. And then we can refer back to biology and psychology sort of to understand what's happening. And that really leads me to the next strategy I used, which was bridging the explanation-action gap. So we see this action that's created with music. This musical stimulus actually affects change in the person. But to understand what's going on, we need to go back to the neuroscientific underpinnings and the psychological underpinnings to be able to explain what's going on. That sort of bridges that gap, that lack of explanation there. And then finally, and this pulls in the sociological perspective most strongly, is advancing through checks and balances. A music therapist has to constantly, in approaching a patient, constantly check back on what they know about this patient and this relationship that they've created with them, as well as what they know about the neuroscientific, psychological limitations of the disease. So it's constantly checking through all these disciplines to be able to create, in this interpersonal relationship, to be able to create an effective care plan. So what did I do? My methodology. I started with very general literature search, and then this was very broad, so I narrowed it down to the Institute of Music and Neurologic Function, which is the lead institute in the field. And I was able to actually speak to Dr. Connie Tomeno, who is a founder of the Institute of Music and Neurologic Function, get some more information from her. I determined my variables. I examined a few case studies of Dr. Oliver Sax's, another founder, and then I analyzed these case studies using a health-related quality of life measure, the Parkinson's Disease Questionnaire, and compiled my findings from there. So what I learned, what I did. What I learned through the literature search, and this sort of brings in a lot of Dr. Tomeno's work, is that theory behind what's happening is that music actually accesses the brain through these various neural pathways. So in Parkinson's, the subcortical structures may be damaged, but we know there's strong auditory connections at the dorsal prefrontal motor cortex. So that's a cortical, that's a higher structure. So despite whatever limitations we may have with these various diseases, there are other pathways to access function. And then in my applied analysis, I used the PDQ-8 to look at these case studies, to score them prior to a music therapy intervention, and then in the process of a music therapy intervention, and was able to see that quality of life did improve in mental and physical capacities. So my recommendations to the field, and this is reiterated in Dr. Tomeno's work, is that there's really a need to appeal to the larger scientific community. The clinical applications are so well-founded, so strong, but the neuroscience is definitely understudied. It's just lacking in the field. So there's room for that. And then personally, I think incorporation more regularly in community care and clinical care would be a place that this therapy could move into. So what's next? So this is a really exciting time right now in the research. There are a lot of questions remaining. There's been some preliminary studies about opportunities for neuroplasticity with this therapy. And there's just a lot of studies to be done, a lot of questions remaining, and IMNF is really spearheading this research. And then for myself personally, I want to move into physical therapy, and I think having this biopsychosocial mindset, understanding why it's valuable, is just so important for me moving into what is largely a biomedical field. So in conclusion, As Opus 49 is wrapping up, I don't know if you can hear it in the background, I'd like to bring you back to Miss Rosalie B. And I'd like you to realize that for these 14 minutes of this song, for about the length of my presentation, she wasn't just being treated, she was completely free of her Parkinsonism for that time. And I'd like you to think about how you would measure or how you would quantify the worth or the value of those 14 minutes for her. Thank you.
Thank you very much, and plenty of time for questions. I meant to emphasize in the intro, we particularly encourage questions from the students, because whatever you're thinking that you could do, we're too shy, so you have to be up.
Have there been any other, so besides Parkinson's disease, are there any neurological or neurodegenerative disorders that utilize music therapy?
Alzheimer's, very much so. Actually, I would say that the research is more substantial in that area, that I had more difficulty looking into Parkinson's.
Is there a reason why you chose literature that was
I think, yes, sorry. I think the PT component, so just as someone who's thinking about rehabilitation science, that was a little stronger there for me.
Could I just ask you about the quality of life measures?
Yes.
Clearly that's a desperately controversial area. Do you have a sense of whether different ways of measuring that would give you different results? Or just unpack it a bit?
Absolutely. I would think that, and I sort of had to work with what I had, given the research that's available, and also that it was really important to me that I looked at a case study rather than do sort of a meta-analysis. First of all, there wasn't a lot of information to do a meta-analysis on quality of life specifically for Parkinson's, and then secondly, because you really lose the understanding of, is this really music therapy? Is this really a person-centered approach when you're not looking at a case study? Is there anything else that you wanted to get from that question?
No, I mean, I think that's a fine way to begin. Do you think the music contributes anything, that your perspective from music contributes anything to measuring quality of life?
Yes, personally, because I'm very fond of music. I mean, who isn't? But I grew up singing, and so it's something that I love, and it was part of why I latched on to this topic. But then also and I put this on my slides, I was hoping someone would ask about it just for fun. The subfields of chronobiology and sonification are these emerging scientific fields that carry these musical perspectives. And I think they carry a lot of weight in realizing sort of the rhythmic component of our nervous system. So I think, yes, music is very powerful there. I don't know if I answered the question.
Absolutely. Thank you.
Could you talk a little bit about how you determine what the best method or what the best musical instrument or outlet is for patients?
Right. As a music therapist, finding the right approach. Yes. So I actually was curious about this myself and asked Dr. Tomino about it when I interviewed her. And her answer was pretty straightforward. She's like, you just keep trying different things. And part of it is experience. You know what you know about a patient, and you know the limitations of their disease. So where you're most likely to see this affecting them and their functioning. And then it's really about, and I have this great quote, and I decided not to include it today because I was actually worried about time, and you guys have heard it, but it's a music therapist, and he compares himself to a musical instrument, and he said that he plays a tune as a musical instrument, and that is to feel out emotionally, cognitively where this other person is, and that you have to be so intuitive, and you're really listening not for what they're saying, but for what they're putting out, the music that they're putting out. So it is definitely something that comes with experience and comes with understanding another person.
Yeah, so there are a few different types of therapies here. So it sounds like there's the music therapy where you're getting the patient to play an instrument, to make music. Mm-hmm. And then there's the type of therapy, and I've seen this video where you're playing music to almost choreograph or reteach movement. Mm-hmm. How are those different, and what's the role of music in each of those cases?
It's, once again, it refers back to whatever that patient's needs are. So if the patient's, I think I was reading a case about a boy with autism, and he had, what he felt his needs were that he had issues with fine motor control, and then he had issues with socialization. So they actually taught him to play the guitar, and it vastly improved his fine motor coordination in his hands. And he was able to play for other people and allowed for this social aspect. And he became a lot more confident in himself. So it's finding that creative approach that answers this person's specific needs. You want to look at what that person wants to accomplish, what their goals are.
Question. I'm wondering how widespread or how available music therapy education and training is now. For example, let's say University of Delaware. Is there a track that you can take within the PT program? And if not, will you advocate while you're there?
I think the first program ever that opened up in the country was at the University of Michigan in like 44. And yeah, it's a separate program. So you kind of have to look at the same way that when I was applying to PT schools, I had to look at where there were programs available. There are only actually 2 in Maryland that are credentialed. And it's sort of the same thing for music therapists. You look for a school that has a program available. It's a BS. You'd go through, do a 4-year degree, and you'd then take a licensure exam, and you'd be an MTBC, so music therapist board certified. And the programs actually are more widely available than you'd think.
They're situated out there, their own thing. They're not part of a physical therapy.
No, it's entirely separate. And actually, what has been really big now is incorporating music therapists into interdisciplinary care teams for clients, for patients.
Thank you. For the sake of time, well, thank you again. I'll move along to our next speaker, Vivian.
Congratulations to Racheal, who is graduating with honors. She took 2 of our core courses for honors credit, including the Capstone. Congratulations, you can accessorize at graduation.
Thank you.